embark on this exciting educational journey together. So, odontogenesis can be defined as the complex process of tooth formation and development. So let's discuss the stages in order. So first we have initiation at 6 weeks in utero. Next we have the bud stage at 8 weeks in utero, then the cap stage at 9 weeks, bell stage at 11 weeks, the appositional stage at 14 weeks, and finally we have maturation at 14 weeks in utero and greater. So naturally, let's start at initiation. So stage 1 is initiation, and this is also known as the thickening stage. Again, this occurs at 6 weeks in utero, and it involves the outer layer of the oral epithelium. The oral epithelium is the superficial most layer of the developing mouth for both the upper and lower arch forms. Below this will be the dental lamina. The dental lamina is a row of thickened oral epithelium that will eventually become the developing teeth, and we'll get to that later. Under this, we have the ectomesenchyme. The ectomesenchyme provides the signal for the oral epithelium to multiply into the dental lamina. So, briefly in the initiation stage, the ectomesenchymal cells will accumulate immediately below the oral epithelium. The oral epithelium will then proliferate down into the ectomesenchyme to form a primary epithelial band. So some common dental defects that will occur during this stage would be congenitally missing teeth and supernumerary teeth, or additional teeth. So next, let's move on to the bud stage. So first in the bud stage, this occurs at 8 weeks in utero. So first, the dental lamina will invade into the underlying mesenchyme. It's important to note at this stage that the dental lamina will become all of the primary teeth and the permanent molars. So, this is also when the dental placode can be defined as a localized thickening in the dental lamina that will initiate formation of individualized tooth germs. So after some continuous proliferation, this will eventually become the condensing mesenchyme. The condensing mesenchyme is when mesenchymal tissues gather together to differentiate into a single tissue type, such as the tooth, bone, muscle, cartilage, and vice versa. So histologically, the dental placode resembles a proliferating tooth bud. Some common dental defects that occur during the bud stage would be congenitally missing teeth and supernumerary teeth, similar to the initiation stage. Next, we'll discuss the cap stage. This occurs at 9 weeks in utero, and this is when the dental placode becomes the enamel organ. So the enamel organ consists of the outer enamel epithelium, shown here, as well as the inner enamel epithelium and the stellate reticulum. So the enamel knot is a localization of cells, and this appears in the thickened center of the inner enamel epithelium. Histologically, the enamel organ resembles a cap over the dental papilla, hence the name the cap stage. The condensed mesenchyme will differentiate into the dental papilla, shown here. So, the dental papilla is very important to us in dentistry, as this will eventually become the dentin and the pulp in the teeth. So this histological slide shows the odontoblasts, the pulp in the coronal section, the predentin, and the dentin, all very important to us as dentists. So a dental follicle can be seen in this image, and this is surrounding the sac of the dental papilla and the enamel organs. So some common dental defects that occur in this stage would be cysts, odontomas, gemination, fusion, and dens in dente. So next, let's discuss the bell stage. This occurs at 11 weeks in utero and can be categorized into 2 stages. This would be histodifferentiation and morphodifferentiation. So let's start with histodifferentiation. This occurs at the end of proliferation, and this is when the tissue will differentiate into distinct cell types, and the inner enamel epithelium will become ameloblasts. Ameloblasts are very important to us in dentistry, and we'll discuss that soon. So the dental papilla will then differentiate into odontoblasts, which is also very important to us, as I'm sure we know. Common dental defects that occur during this stage would be amelogenesis imperfecta and dentinogenesis imperfecta. So now let's discuss that second stage we talked about earlier. That would be morphodifferentiation. So this occurs when formative cells arrange to determine the shape and size of the future tooth crown. So some dental defects that will occur here are peg laterals, macrodontia, or large teeth, and microdontia, or generalized smaller teeth. So next, let's discuss apposition. This occurs at 14 weeks in utero. And in apposition, we have the initial deposition of tooth tissue matrices. So this is where we have our odontoblasts mentioned earlier, and these will deposit a dentin matrix of collagen, which signals ameloblasts. Ameloblasts will deposit enamel matrix of amelogenin, which signals root development. So in apposition, we'll have a cervical loop, which will then become the Hertwig's epithelial root sheath, and the remnants of this will become the epithelial rests of Malaceae. Also in apposition, the stellate reticulum, which we discussed earlier, will then become the reduced enamel epithelium, which will then eventually form the junctional epithelium we'll see in the mouth. So some common dental defects that occur during apposition would be Turner's hypoplasia, enamel pearls, and concrescence. And finally, after lots of hard work, we've reached the maturation stage, which we discussed occurs at 14 weeks and greater in utero. In the maturation stage, we'll have a final deposition of enamel and dentin, and these processes involve both calcification and mineralization. So the calcification process begins at the cusp tips and the incisal edges. So a primary tooth crown will mature in about 2 years, while a permanent tooth crown will mature in about 4 to 5 years. So some common dental defects that occur here would be enamel hypomineralization, fluorosis, and tetracycline staining. So after a long journey, we finally reached a tooth. So this summary will really describe the dental defects that may occur at each different stage of odontogenesis. And here we have a nice flow chart that will discuss the different tooth structures and how we've gotten there. So briefly we'll review that the tooth germ will become the enamel organ, dental papilla, and dental follicle. The enamel organ will have ameloblasts that will then produce enamel. The dental papilla will have odontoblasts and central cells. These odontoblasts will produce dentin and central cells that will eventually become the pulp. And finally, the dental follicle will have cementoblasts, osteoblasts, and fibroblasts. And these cementoblasts will eventually form the cementum. Osteoblasts will produce the matrix for alveolar bone, and fibroblasts will contribute to the formation of connective tissue and subsequently the PDL ligament.